So number 1, how is COVID primarily spread to others? We said, I'm going to say it's B, droplets. Correct? Good. 2, wearing of gloves is an acceptable substitute for hand hygiene. Everybody said that was false, right? 3, select the signs and symptoms of COVID. We're going to say it's all of them. It's fever, cough, sore throat, fatigue, shortness of breath. 4, a person with COVID-19 can transmit the virus even though they are asymptomatic. True, very true. That's what makes it so scary, because of that 14-day quarantine, because we don't know when it's going to, you could be contagious, and we just don't know. You don't know yet because you don't have symptoms, correct? The coronavirus cannot live on skin or other surfaces. We know that is false, correct? 6, the proper order to remove PPE after caring for a resident on droplet precautions is C, gown, gloves, N95 if needed, and then hand hygiene, correct? I put an A and B, I put the shoes on there, thinking that that was going to help people. That was going to be, no one's going to be kicking off their shoes, walking around barefoot or with their socks on the floor. And then I had somebody, I don't know if it was a smart aleck or just a smart person, said, oh, what about those booties that you put on top of shoes? I'm like, okay, I didn't even think about covering that. So A, but C is the correct answer. And I hope you didn't put D, because if you think that we don't need PPE and a droplet precautions, we're going to have a little talk afterwards. So 7, the same gloves can be worn from resident to resident. That's false. 8, a resident should be reminded or assisted with hand hygiene before every meal. True. There's a little critical thinking there, because we know that they have germs, and we could have COVID on our hands, and it's just good hygiene. 9, which of these statements is true? A, hand hygiene should be performed with soap following caring for a patient with diarrhea. Using only alcohol-based hand sanitizer would not be sufficient. That is true. B, EVS is the correct department to contact regarding needs for PPE and cleaning supplies. That is true. C, dietary should be contacted when a resident's COVID test is positive so that disposable items can be used. That is true. So A, B, and C are all true. And then 10, cleaning agents approved by your facility with an EPA registered number listed on the original container that dictates dwell time, the kill time that needs to stay on the surface, to properly disinfect a surface. That is true. Any questions with the quiz? Any comments? Okay, why don't you pass those back to me? I will probably start the conversation about the vaccine, because Dan's So the handouts that you have are actually ones that Darren pulled off the internet, basically I think from the CDC. And it's really exciting stuff because, as you know, the vaccine has been released. It has been starting to be trialed actually with actual healthcare workers. So depending on how you feel even about the virus, about the vaccine, if we were to get it or not, we're really living in historical times right now because of just the pandemic alone, and now with this vaccine coming out. If I can see a show of hands, I want to see how many people are 100% when that vaccine comes out for us, that you're going to be one of the first ones in line. I'll definitely take it. We won't get you on tape, that's okay. Who's going to actually take it? Nobody. Who's on the fence? On the fence? People are still on the fence? Who's not, like, I don't believe it, I don't want to take it, you couldn't pay me to take it. Okay, I know people didn't raise your hand. You got to pick one. All right, help me out here, okay? All right, who's definitely taking it? Absolutely. Who's going to be one of the ones taking it? Who's on the fence? Okay. Who's not going to take it? I assume that you're not going to take it, correct? That's okay. You can definitely say no. It's not something that it's mandated. It's something that we're trying to get a feel of, and that's part of the educational process and understanding, why. It's a very difficult decision for many people because it's a lot of unknowns. But part of this conversation that we're having now is to try to kind of mitigate that and try to kind of calm some fears and bring those other issues like why you wouldn't take it, have this be a debate, have that be a very good educational process for everyone. One of the things that we know, the two vaccines that came out, one from Pfizer and one from Moderna. The Pfizer one is actually being released right now. It's more for being used in hospitals and the acute care setting, primarily because of the storage ability. So that vaccine actually needs to be stored at sub-zero levels, and we wouldn't obviously have that kind of capacity in our facility. The amount of effectiveness, according to research, they're very, very similar. I think it was like a 0.05 difference in the effectiveness of either one. The last time I looked online, the Pfizer they're saying is about 95% effective, and the Moderna was 94.1. So very, very close, very, very similar. I don't know what the reading that you've been doing, but for right now we know that both vaccines are what they're called novel because they're using a technology called RNA technology. So what that is that it's been studied for the last 15 years. That technology is not new. That is something that's been used with other medications, with antibiotics. It's not something that they kind of drummed up. So that makes it comforting. It's called mRNA technology because what it is, I don't know if you remember back in high school that we used, understanding what the proteins are made of. Proteins are made of building blocks, and those building blocks are the ribosomes that help make up the DNA. So it's a very, very small part of making up a protein. So what they did is they took a very small part, that RNA, from the crown, the spike part of the virus, and were able to duplicate that. So it's not the virus itself, it's not a live virus, it's not like in other vaccines. You either get a live virus or the killed virus. There's nothing as far as no full virus in this vaccine. It's just that RNA. So what that's meant to do is that your body, when it's injected into your body can still recognize that as being foreign and produce antibodies accordingly. The Moderna has two different doses that would need for you to be fully immune or considered immune. So you take the one, and then 28 days later, you would take the other one for the entire shot. How it's being rolled out right now is that they're in front of the FDA as we speak. We are anticipating that they will get approved by tomorrow, and the manufacturers actually have everything ready, packaged, ready to go, and supposedly be shipped out, particularly the islands in Hawaii here, by Monday. They're anticipating that facilities will start having to get clinics and schedule clinics and receiving the vaccination by December 28th or the first week of January already. So it's moving very, very quickly. On that note, I know a lot of people were speculating as far as how quickly this vaccine was coming up. They're rushing everything. They're pulling everything, a little bit too fast. Well, according to research, they haven't made any kind of shortcuts. It's the fact that they had this technology already ready. It wasn't something new. So now they were just waiting for the perfect time, the perfect storm, so to speak, to be able to use that for vaccination of a population. What we're hoping for is we need at least 70% for nationwide, worldwide, for herd immunity. Have you ever heard that? The herd immunity is something that what the majority of the population is immune to a particular disease, which makes the more vulnerable people more safe. So think about that back like the MMR, measles. So most kids can't get the measles vaccine, the MMR, until they're at least 12 months old. And also kids that are immunocompromised, kids that have cancer, can't get those boosters, and so they're at risk of getting measles when they're going through treatment. They rely on herd immunity to keep them safe. So in order for us to keep society safe, we're hoping for at least a 70%, hopefully higher, to do that. A couple different things that the CDC is saying that what they tested everything from about 35,000 to 45,000 participants with a diverse kind of background. They had very good response to them. They did have some adverse side effects as far as we heard about Bell's palsy was back an incident in the UK. Supposedly that had nothing to do with the actual vaccination. And I don't know if you heard about, there were 2 healthcare workers that received the vaccination, actually used the Pfizer vaccination, that was yesterday, that actually had very severe allergic reactions. One was, because after you get the first vaccination, you have to sit for about 15 minutes just to be observed to make sure that you're not getting any kind of problem. And this woman evidently went into an anaphylactic issue, that she has a shortness of breath. They had to give her an EpiPen. That didn't work, and they had to wound up transferring her to a hospital, had to give her an Epi-drip and some Benadryl and keep her overnight for observation. Another person at that facility as well had an issue, did not go into anaphylactic, but had puffy eyes, got a rash on their skin, again, had to be transferred to a facility, given Benadryl, no Epi this time, but had to be observed, and they were fine. I guess what they found out from these 2 people, the one woman that had the severe anaphylactic had an egg allergy, which is interesting. They're still trying to figure out why that happened, because the COVID vaccine does not contain eggs. So they don't know why she had such a severe reaction. And then the other one, he did have a reaction to a previous medication a while back, but never had any kind of issues before. So they're still investigating that. As far as contraindications, so the CDC does come out and say that if you have a history of anaphylactic, you carry like an EpiPen for peanut allergies and bee stings, they want you to contact your physician, contact your PCP to be able to have that. They still recommend you getting it, but they want you to be monitored maybe in a doctor's office, or if they're going to be doing it in a hospital, just so you're monitored a little bit more closely. They don't recommend it right now for pregnant women. They're on the fence for if you're actively trying to get pregnant, for these women that are trying to get pregnant, that you contact your OBGYN to see what they think about that. But as far as if you're not trying actively, we certainly recommend that you get it. And if you have any kind of immunocompromised issues as well, any kind of lupus, any things like any kind of cancer treatment, anything that would lower your immune system. Some of the side effects that you'd be looking at, you could have signs and symptoms that are consistent with COVID. Particular fever is going to be an issue. So we're still trying to figure out how the staff is going to be offered, or we're going to do 2 clinics or 3 clinics, because how this is going to work is that Farm America, your pharmacy that you work with, as offered, or I don't know what the word is, as far as contracted with Moderna and Walgreens. So Walgreens is actually would be coming, they'd be scheduling the clinics kind of how you do with your PCR and your COVID testing, your rapid testing. They'd come for one day, actually do the injections for the staff as well as the residents, and they would come back again 28 days later and to do the second one. It's still on the fence to see if we're going to do 2, if we're going to do 3, how we're going to be able to divvy that up, and that should be being able to be rolled out by your administrators in the next week or so. So let me know, what are some of the reservations that you have? I'm not here to convince you. I'm not here to, tell your name or anything like that. As far as any kind of reservations that you'd have that you've heard about, of why you'd be skeptical about taking the vaccine. Anybody want to share? Nobody wants to be on tape. That's fine. One of the things that, it's still something to consider, obviously do your research, understand what you're getting yourself into. Yes, we don't know what long-term, we don't even know how long this vaccine would last, though. Would it be something that we have to have, like the flu shot? Do we need it every year? Will we have lifetime immunity like we do for our childhood vaccinations? We don't know. This is the very first attempt to make that swing go down for the pandemic. We also don't know, as far as what we know about COVID, that it affects everybody differently. So everybody in this room can get a different kind of reaction to the virus. And I think that is probably a little bit more serious and needs to be considered and looked at and talked about even more readily than, oh, I think this is conspiracy, or oh, I heard this on, this website. That I've taken patients, part of my background is that as a nurse practitioner in Chicago, I worked at a pulmonary clinic. So I took care of people with asthma, cystic fibrosis, congenital issues, as well, all breathing issues. And I've had people that wound up in a 19-year-old that wound up in a hospital, was an athlete, and he was perfectly healthy beforehand. And then even my cystic fibrosis patients that we were so afraid of when they found out they were COVID positive, that luckily they didn't wind up in the hospital. So it's very, very scary to see how it reacts to everybody. A little bit of personal history about me. My brother actually had COVID. So my brother is 15 years older than me. He's in his 60s, and he has absolutely no other underlying conditions whatsoever. He's active. He's not overweight or anything like that. Memorial Day weekend, he was watching my niece's kids, his grandkids. 4 days later, her family found out that she was COVID positive. She's a nurse at a teaching hospital in Chicago. And a week later, he started having symptoms, and within 5 days, he was on a ventilator. And he lasted on that for about 2 months. They had a trachom, because they couldn't get him off. He lost a good 40% of his renal function. And once they were able to wean him off, that he had to learn how to walk again, because he had lost, so much muscle mass and the ability for his legs. He had to go to physical therapy. Did learn how to walk, got out of physical therapy. Actually, I heard when I got here a couple weeks ago that he just got cleared to get his driver's license again. So he's living back home by himself. He's doing okay. Though I do recommend, he's never a good driver to begin with. So if you're in Illinois, kind of keep an eye out for him and, just watch the roads for him. But we don't know. And I also know people that have been smokers for 30, 40 years, and they were sick for 3 days. So we just don't know how that virus is going to affect our immune system. And the biggest problem with this virus is it infects the inflammational process in our bodies. There's no way to tell what's going to happen. So thank you so much. If you have any questions, if you have any doubts or anything like that, please talk to me, talk to Stacy, talk to the administrators, talk to Darren, as far as bringing these issues to us, showing us where you're getting this information, so we all can be educated and all give that information out to, that stays consistent, and we want everybody to be safe and move out of this terrible, terrible pandemic. Thank you so much. Go home. Have a good day. Stay dry. Any questions? Thank you, everybody.